Hello, I'm Dr. Melissa Hague. I'm a practicing OBGYN. I deliver babies, lots of babies for a living, and take care of women in all phases of life. And this is my friend, Dr. Delane Vaughn.
Hi there. I help women reverse their type 2 diabetes. I'm a family practitioner by training, but really what my passion is helping people live naturally healthy lives. And part of that involves helping women reverse their diabetes. So we're going to talk today about approaches dietary wise that you can help your gestational diabetes with.
That's right. And why would an OBGYN partner with someone who reverses diabetes? Well, that's because all I see every day right now is gestational diabetes. However, we do want to make sure you know, even though we're doctors, we may not be your doctor. So this is not medical advice. This is just some experience that we've had and some thoughts that we want you to consider as you start your journey with gestational diabetes.
Yes, on that same note, if you have been medicated already, if you've already been started on meds for your gestational diabetes, you have been medicated for the way you have eaten in the past. If you hear this information and you change the way you eat, you need to have a conversation with your doctor. If not, you can get very, very sick, involving hospitalization, ER visits, all sorts of nastiness that goes along with that because you didn't have that conversation, because you changed the way you ate and you're still continuing the meds that your doctor started you on. Get a clear line of communication with your physician or whatever medical provider has started you on these meds so that they can adjust those meds down as you make adjustments to your diet.
Food is medicine.
Yes, it is.
Dangerous. So just want you to make sure that you are in the best care that you can be, and doctors can only help you if they know what you're doing. So provide this resource to them and tell them this is what I'm going to try to do.
All right, so we're going to share some slides with you. If we can get them going. I want to get them in this view. All right.
How exciting.
There we go.
Okay. So what is gestational diabetes and why do I have it? I wanted to start this video with, I'm telling you, you have diabetes. And I have told hundreds of women they have diabetes. I now let my nurse tell most of them.
Wow.
Lots of anger and crying. And,
nurses just do better with crying.
Frustration.
So go ahead and take that.
Yeah, in the beginning, I kind of did all of it, and I'm like, oh, my nurse could tell you. So, but I'll just tell you, yes, Delane, you know, we had you take the 1 hour, and then you did the 3 hour, and that 3 hour result shows us that you do have gestational diabetes. I want you to know we're going to help you get the best care you can, but we're going to have to change some things.
Yeah. And of course, when women hear this, oh my God, I've messed it up. There's guilt. There's how have I screwed this up? This is dangerous for my baby. That, and then, you know, there is honest Abe. We've both had children. We know those little things, they leach from our bodies. They take it all.
They do.
And now they're taking my food too.
That's right.
I had gestational diabetes and that was exactly what I thought. They had taken it all and now they're taking my food too.
Yes, but it's not a moral issue.
Okay? It is not a moral
issue. So when I tell someone and they're like, I'm a bad person and I've done so, this is not what this is about at all.
This is a biology issue.
This is, your body has done exactly what it's supposed to do, but now we need to give it different fuel so that you can change what it's doing.
Absolutely, absolutely. So remember that. Why you have this has nothing to do with your value. It has to do with the biology. We are going to try to teach you today about the biology of why this is happening so you can make some changes there.
Absolutely.
So gestational diabetes is caused by insulin resistance. And insulin resistance is caused by high concentrations of insulin released into your body and being exposed to that over a prolonged period of time.
Now, the catch is, in pregnancy, you do have a degree of insulin resistance that is intentional and physiologically there because of the child. The problem is when you start out the pregnancy already with insulin resistance and you continue your SAD diet, which we'll get to here in a minute, which makes it even worse. So now your normal low level of physiologic insulin resistance becomes a huge problem.
Absolutely. So let's talk about kindergartners, because insulin resistance is not
getting a headache already
that people understand easily. Yes, this picture doesn't give me quite as much anxiety. The next one will, though.
Yeah.
I always talk about kindergartners or a room full of children. If you have a small group of children that you're responsible for, say 5 children, you can be very responsive to their needs. You can hear the messages they're sending you. You can see one wiggling in their chair as they're drawing or coloring, and you'd be like, oh, that one needs to use the bathroom. You go ahead and go to the bathroom. And you can see one raising their hand and asking a question. They don't have to talk loudly. You can be very responsive to the messages coming from a handful of children. When you get too much, a room like this, it becomes the message, the noise, which is again just a message you're trying to hear, becomes so overwhelming and so various. It's chaos, and you can't understand these low level messages. Maybe the kid next to them can hear it, but you cannot hear those messages. So you have this low level, this baseline level of noise. Now, one child could get your attention from this room by yelling louder than that baseline level of noise, and you would hear the message, you would respond. But what that does to that baseline level of noise is ratchets it up. So now you have a higher baseline level, it gets noisier. And the next kid needs to yell louder, and then it just gets noisier. And it really just devolve into chaos. Okay.
Yes. This many kids would devolve into chaos.
This many kids looks like chaos.
Yeah. Bless you, teachers.
Yes, yes, yes. They are saints. So what is the answer to this insulin resistance, to too much insulin? The answer to too much insulin, kind of like the answer to too much noise in that room, is not adding more insulin. It's not adding more noise. It's allowing the noise level to drop off. It's allowing the insulin level to drop off. You have parents come and get their kids to where you're back down, instead of having 50 or 100 kids in a room, you have 5. You go back to that space where you can be very sensitive to every little noise that they make.
Absolutely.
If we can drop your insulin level low, your cells will go back to being responsive to small amounts of insulin. We don't have to keep ratcheting up the amount of insulin in your system.
Yes. And that's the goal. We want your insulin to do all the work so that you don't have to go on medication.
Absolutely. So, cause and effect here. Again, everybody thinks it's the sugar in their food that causes the high blood sugar. And yes, but it's not that direct. The food that you eat causes you to make too much insulin. Having too much insulin in your system leads to the insulin resistance. That insulin resistance allows your cells to stop responding to insulin effectively, and that allows your blood sugars to go high, and that's what we pick up as diabetes.
Right. So we measure an indirect.
Yes, we do. Although everybody really does think it's like, no, this is what's causing my diabetes. It's not. We have to fix that middle step of that insulin resistance component so that you can get your blood sugars normalized out. And that's what we kind of miss, I think, in most recommendations by different dietary organizations. So,
yes.
All right. So let's talk about the SAD diet, the standard American diet.
Make your diet happy, guys.
What is wrong with the food that we're eating? The standard American diet is made up of foods that are not really natural to the human body or to the human biology.
No Twinkie trees.
There aren't Twinkie trees.
Dang it.
I have yet to find the, pizza tree, and I would love to find the pizza bush, the pizza tree, however it is, the pizza patch. We need pizza patches.
Yeah, that'd be great. Right next to the strawberries.
Right. We grow the pizza next to the strawberries. So this food that we're eating, it's really the primary component of the standard American diet, is carbohydrates. The response of insulin resistance is a normal physiologic response. There's nothing wrong with your body. You do not have diabetes because your family had it. None of that is happening. This is a normal response of the human body to food that really is not normal to the human body, to our biology.
Which means you can also change it. I've had so many women say, well, I knew I was going to have diabetes. Everyone in my family has diabetes. Well, I would tell you the vast majority of my family is morbidly obese. Like we're talking 300, 400, 500 pounds morbidly obese. Does that mean I have to be that? No. I thought that for a long time, but
yes,
that's not the case.
I like to remind people, you don't inherit diabetes or these disease states from your family. You inherit your love for apple pie and pizza.
Yes.
That's what you get from your family.
The emotional response.
So it makes sense if you eat the way your family eats that you kind of get the same disease. Yes. Because it really is correlated. It's directly associated to the foods that you're eating. So let's talk macronutrients. Macronutrients are the heart of what causes this insulin response from our body, okay? There are 3 main macronutrients: fats, proteins, carbohydrates. And each of them have a response of insulin from the pancreas. So if you eat fat, like butter, get really
heavy whipping cream.
That's probably more reasonable. I don't know that anybody eats sticks of butter, but if you eat straight fat, you're going to have a very, very insignificant insulin response to fats. Right. Okay. That's just how the body works. If you eat proteins, you're going to have a moderate insulin response.
Steak. I'm all over the steak.
I love steak. Yeah. If you have carbohydrates, you're going to have a huge surge. There's a very substantial insulin response to carbohydrates. If you eat processed carbs, like we're talking about with the standard American diet, you're going to even have a more intense surge of insulin. And that's partly because fiber is no longer bound to the carbohydrate in those foods.
Absolutely. And I didn't even know all of this information. Even going to medical school, I didn't learn this stuff. And when I started to decide I didn't want to be 300 or 400 pounds someday, and I really wanted to start caring for myself, I had to kind of go out of the mainstream medicine and say, what do I need to be doing here? Because the American Diabetic Association's recommendations for gestational diabetes, in my opinion, are ridiculous. And they will put you on insulin in no time flat. And when I came to this process, I mean, there were definitely days I had nothing that didn't come out of a box.
Absolutely.
Nothing. Cereal. What do
For
we
breakfast?
say? Pizza pockets.
Pizza.
Oh, love the
the
pizza
hot
pockets.
pockets. The hot pockets.
Hamburger helper. Like it all came out of the box. And that's where I started to get into trouble, where my insulin levels were going up.
Absolutely. Absolutely. And we'll talk about this, but it's not just the carbohydrates. Like it's not just, oh, there's 0 sugars in this.
Right.
It's also the way the food tastes, and the sweeteners, the artificial sweeteners can also have an effect on this. So we'll talk about that. But yes, really, truly, if it's a processed food, this is probably going to surge some insulin in your system.
It is. At the core of what we're saying is if it didn't grow or eat things that grow, try not to eat it.
Yes, it's not meant for your body.
No.
So the standard American diet is just abundant. It's just riddled with highly processed refined foods. When we process natural foods, so when we take a strawberry that you can pick from the ground and we make it into jelly, what we do is we heat that natural food. That natural food then becomes, when it's warmed, when it's heated, the carbohydrate separates from the fiber component. The fiber gets degraded, and we just concentrate that carbohydrate component of it.
And then we put it in a Twinkie.
Yes, or a Twinkie. I didn't even know they had strawberry Twinkies.
All kinds of flavors.
It's insane.
In the last 70 years.
They have sugar flavored Twinkies. I don't care what you call them. Sugar flavored Twinkies, all of them. But so we concentrate, this refining, this processing of our food concentrates the carbohydrates. Same thing with wheat, right? Wheat grows in the ground, but that's not how we eat it. We pulverize it. We pull out all of the fiber, all of the micronutrients, the vitamins, the minerals, and we concentrate the carbohydrate component.
And make donuts.
Yeah, and then we add sugar to it. It's truly, it's what we do. Even like honey wheat bread. What do you think makes a honey? They aren't putting honey in that stuff. It's sugar.
Right.
So when we eat these foods that are highly processed and refined, they cause our blood sugars to climb quite high. And then our insulin is produced from that. The pancreas spits out insulin in response to that blood sugar that's been absorbed. That occurs not only with the foods that we're eating, but again, it occurs with the things that we drink, the sodas, the Frappuccino Bappas from Starbucks, the Gatorades, all of those things, the energy drinks, all of them. And even the diet drinks. And again, this is a Pavlovian response. So it doesn't happen for all the humans, but my suspicion is if you're a human with insulin resistance, it's probably happening for you.
Sure. And you know about Diet Coke, girl.
Oh, yeah.
We've known each other since she was a resident.
Yes, we've known each other.
It was an addiction.
Yeah, I did. You know, people are so cute. They'll be like, I have 4 or 5 a day. And I'm like, I had a 12 pack. Plus, I would go to like the convenience store and I would get the tall boys, like 2 or 3 of those. Yeah. That was what I drank in a day.
It's amazing.
That is why that was my pre-diabetes. That was my insulin resistance. I have no doubt. But that sweetness on your tongue will tell your brain that something carby is coming, and your brain will prep for that by sending a message to your pancreas to spit out insulin.
And then your appetite goes out of control because that's all you want.
Yes. So be very, very careful with those sugar-free anything.
In pregnancy, I tell people not to consume.
I agree.
We just know so much about chemical sweeteners, artificial sweeteners. We give them to mice to see what kind of cancer they'll grow. And again, we're not talking about causing your child that kind of harm, but if you think it's bad for you, I mean, I've seen so many women stop their cigarettes, stop their liquor. I would just tell you to consider stopping your artificial sweeteners as well. Just put all those on a shelf.
And even like looking at your foods in the same way. What is meant for, what is healthy? What do I know is healthy in this moment? Because there's nothing about a Twinkie that is healthy, right?
We don't need to grow a human on Twinkies.
We don't.
It's not helpful.
It's really not. So recognize that these foods, these processed foods, cause a huge surge of insulin. And then as the standard American diet, we're drinking or eating something all day long. We get that prolonged exposure. That's what's wrong with the way we eat in America. That's what's wrong with our diet.
Oh yeah. There's no such thing as breaking your fast anymore, because people eat up until the time they go to bed and they eat the second they get up. There really isn't any fasting anymore. Breakfast used to meant you broke your fast,
yes.
because you hadn't eaten since dinner the day before.
Ideally.
But that's not,
not in America. I haven't eaten since I fell asleep and could no longer put food in my mouth.
Yeah.
That's the American way. So when you think about the food that you're eating, these processed packaged foods, we're going to go through a couple of these food items, a couple of really nutritional labels is what we're going to go through. These, I'm not bringing up a Twinkie or a Snickers bar that you clearly know is a problem. These are going to be foods that most people would label as healthy, okay? So this is a protein bar. If you look at the label on the right side of the screen, you can see that there are 24 grams of carbs in this bar. If you look over here on the left, you can see there are 20 grams of protein. So
it should be called a high carb bar.
It really should. I don't even know why are we talking about protein on this high protein bar? I have no idea. This is carbohydrate.
Well, but have you ever just tasted protein powder by itself? It's like cardboard.
Yes.
So you've got to add some sugar.
That's exactly what they do. That's exactly what they do. So this is a quote unquote, this is not Lucky Charms, guys. This is a healthy cereal, quote unquote. But if you look, there are 2 grams of fat, there are 12 grams of protein, and there are 40 grams of carbohydrates. This is carb.
I mean, when people tell me I eat cereal every day, I say, well, that's gotta be the first to go.
Yeah,
because
thank you for telling me exactly what you should stop doing.
Awesome. Cereal and then milk, especially if you're having skim milk, it's mostly sugar. So you're
not getting any fat with it.
You're having a huge carb load to start your day when your whole goal is to reduce your insulin resistance.
And I know that in America, they demonized fat, and I don't agree with that. I'm not saying that that was appropriate. And there's a lot of evidence being released right now that that was, one, inaccurate study, like the literature was inaccurate, but 2, that that's not the way we should have been doing it. But do understand, if you only have 2 grams of fat and 40 grams of protein, or 40 grams of carbohydrates, there's nothing to slow that absorption of that carbohydrate. All you're getting is this huge surge of carbohydrate into your body.
And then you throw on, like I said, a low fat.
Yes, a low fat milk. Right. A high fat milk product is what you want to do. Get some fat in there to slow it down, but please just don't eat cereal. There's nothing good about that. Nothing good is coming from that. And then of course our classic Quaker oatmeal. You can see my thumb is over the heart in that, but this may be, if you read, it may be part of a heart healthy diet is really what that actually says. Wow. But again, you can see there are like 2 grams of fat, there are 4 grams of protein, 33 grams of carbohydrate in this packet of.
And that's if you eat one packet.
Yes, one. Yes.
And don't add anything
to it. Yes. Yeah. So these, again, I'm not going through Snickers bars. You guys know Snickers are probably not ideal. These are quote unquote health foods, and you really have to look at them with a critiquing eye to get clear on what you need to and what you don't need to be eating.
So then what do they need to be eating?
What do they need to be eating?
What we need to be eating.
What we all need to be eating. So here's the deal, kids. We're human beings. We are human animals, just like all the other animals on the planet, right? And again, I always joke, I feel like I say this all the time, but it is so true. We are the only animal on all the planet that doesn't eat the food that the earth makes for us. Squirrels do not complain about acorns and ask for pizza at night. Deer does not get bored with grass and ask for Chinese food. We're the animal that says, I see your lettuce, your cucumbers and tomatoes, but I'm going to eat Red Bulls and Doritos.
Yeah.
That's why we're
And I'm going to go to the pizza bush.
No, there was a pizza patch. Was there a pizza patch?
Oh, next to the strawberries.
Right. Yeah. Yes. No. So you have to be eating food that the earth makes for you. That's what those foods are made with the perfect ratio of macronutrients, those fats, carbohydrates, and proteins. They have the perfect macronutrients, perfect amount of fiber, micronutrients, everything that the human body needs to be a human body is in those foods that the earth makes for us. And that really needs to be primarily what you're eating.
And this is a revolutionary change for a lot of my patients, because this is not how we grew up. I mean, we really grew up in the era of quick and easy and fast, and that has to change. And you can eat healthy, quick, easy, and fast. I mean, it doesn't take a long time to prepare a strawberry.
No.
But it does require a complete shift in what's important to you and what you're going to do to make this the healthiest pregnancy you can have.
Absolutely. And when you're pregnant, there is a time component that makes you feel a little pressured on it.
Yeah, for
so
sure.
Give yourself space.
God. Can you imagine if you got pregnant and then never got out of it?
Got out of it.
Yeah. Thank God it is time limited.
Yeah. So, but remember, like, you're going to have to like implement some strategies, list making, reminders, all of these things to change these patterns that you've had up until now, because it is going to be a big shift.
Well, even, I mean, when I was pregnant, I had placenta brain real bad. Like I couldn't remember where I put my keys or anything else. But even when I wasn't pregnant and I started changing how I would eat, I would mindlessly start eating something that was just part of my life, part of my habit. And I would have to like remind myself, okay, I don't eat this way anymore because I want to be healthy.
Yes.
I want to live a long time so I can take care of my grandkids and make sure they know how terrible their parents were when they were children. But I can't do that if I'm eating out of the
Twinkie treat or the pizza patch.
Yeah, exactly.
So that's what we have for you in this video as far as what to eat, what to avoid, and why it's important. Why is the food that we're eating causing your gestational diabetes? That's what we have in this video. Stay tuned for the other videos. Certainly, if you're loving this, if you find this helpful, if this is revolutionary and nothing you've ever heard before, share it with everybody you know, but more than that, share it with your doctor. Let them know that this is out there and that this is what you're wanting to do. Have them give you their feedback. Ask them any questions that you have, see what they say.
Absolutely. Thanks for tuning in.